that is called diuretic. Clear? And there is another term that is called natriuretic, substance that promotes the renal excretion of sodium, right? So diuretics are the substances that promote the excretion of urine or increase the volume of urine, right? And there is a term that is called natriuretics, substance that promotes the renal excretion of sodium. Okay, before discussing the uh, different group of diuretics, you know, the volume of urine or urine formation or urine is going to be straight out through kidneys. There are different segments, and as you know, the basic functional unit is nephron, and there are different segments. That is, you can see the Bowman capsule, right? Proximal convoluted tubule, descending loop of Henle, ascending loop of Henle, distal convoluted tubule, and then collecting ducts, right? So these are the different segments of a nephron, right? So why this diagram is important? Because the basic, what you must know at least when we are going to discuss the classification of diuretics, you must know the diuretics which are acting on proximal convoluted tubule. What are the diuretics that act on the descending lymph loop of Henle? What are the diuretics that act on the ascending lymph loop of Henle? What are the diuretics which act on distal convoluted tubule? And what are the examples of diuretics that act on collecting duct? So this is very important. So there are different, again, I'm going to discuss this. You can see the proximal convoluted tubule, basically the main diuretic carbonic and hydrase inhibitor group. This is the main group that act on proximal convoluted tubule. And the second example is the osmotic diuretic that act on proximal convoluted tubule as well as in the descending lymph loop of Henle. And the ascending lymph loop of Henle, but the diuretics which act on thick lymph loop of Henle, and that group is labeled as loop diuretics. This is one of the most important group. And the distal convoluted tubule, the group which acts on distal convoluted tubule, that is the thiazide diuretic, right? And on the collecting duct, we have sodium channel blockers and spironolactone, also labeled as potassium sparing diuretic. So today we are going to discuss two important groups, loop diuretic and thiazide diuretic. Loop diuretic act on thick ascending lymph loop of Henle, and thiazide diuretic acts on distal convoluted tubule, right? So another important point, the weakest diuretic group, which one is the weakest diuretic group among all these examples that we have mentioned? Carbonic and hydrase inhibitors supposed to be the weakest diuretic, and which group is supposed to be the strongest diuretic? That is the loop diuretic. Okay, so why we are going to label loop diuretic as a most powerful or efficacious diuretic group? Why? One important point, a very important statement in our body or in the urinary system, where water moves, where sodium moves, water follows. This is an important point. Where sodium moves, water follows. What does it mean? When the sodium, when there is sodium reabsorption, so water will move along with sodium. And if the sodium concentration increases in the lumen, right? So what will happen? Increase solute sodium concentration. Now it will catches water from inside to outside, from the plasma into the lumen. This is important. So what we do and what is the basic concept of diuretic? We try to inhibit the reabsorption of sodium, because when we inhibit reabsorption of sodium, water is not going to move or enter into the plasma. So what will happen? So that means why we are focusing on this point, because when we use diuretics, two important conditions. One is the edematous condition, when the excessive fluid is increased in the body, right? Or in the interstitial space or in the plasma. Important conditions in which increase fluid volume, that is the uh, heart failure, in which pulmonary edema occurs, generalized edema due to cirrhosis of liver, right? So basically, diuretics we are using to get rid of excessive fluid from the body, right? And this is the logic, because if we inhibit reabsorption of sodium, now further water reabsorption can be inhibited. So this is the logic. And now the question is, why I am labeling group diuretics is the diuretic of powerful diuretic or efficacious diuretic? Because you know in this thick ascending limb of loop of Henle, highest amount of sodium reabsorption take place, around 25 to 30% sodium reabsorption take place in this thick ascending limb of loop of Henle. Otherwise, in distal convoluted tubule, 2 to 5%, right? So that means if we inhibit highest amount of sodium reabsorption, so what will happen? When the sodium is going to be accumulated in the lumen, it will catches water molecule from inside to outside. This is how we can get rid of excessive fluid from the body, right? Now, this loop diuretic active in loop of Henle, this already we have discussed. And on which segment? Because if we say ascending loop of Henle, so again ascending loop of Henle is further divided into thin ascending limb of loop of Henle or thick. So this loop diuretic basically act on thick ascending segment. And examples, this is important. In our setup, in our ward, in our hospital setup, this furosemide, this is one of the loop diuretic that is being used extensively, right? And the market name, the famous market name of this furosemide is Lasix. Other examples of loop diuretics, bumetanide, torsemide, and ethacranic acid. So these are the examples of loop diuretics, where it acts on the thick ascending limb of loop of Henle. Now the mechanism of action. It inhibits apical sodium potassium chloride transporters in thick ascending loop of Henle. It enhances passive magnesium and calcium excretion, right? So due to positive ingredient. So it also enhances, it not only enhances the excretion of sodium chloride or potassium, but also it enhances the excretion of magnesium and calcium, right? It increases potassium and hydrogen excretion, inhibit reabsorption of around 25% of glomerular filtrate. This point already we have discussed. Therapeutic uses, this is important, right? And already we have discussed. the most common condition in which we generally prefer to use this loop diuretic, that is the edematous condition. This edema due to heart failure, in which we have pulmonary edema, right? Or this could be uh, due to nephrotic syndrome, right? So due to cirrhosis of liver. So edematous state in which we can use this loop diuretic. Okay, chronic renal failure, hypertension. One important point that is usually for mild to moderate hypertension, we use thiazide group. We use thiazide group. We do not use loop diuretics for the treatment of hypertension, especially mild to moderate hypertension. Okay, if there is hypertension crisis or hypertension is not controlled with conventional thiazide group, then we can use loop diuretic in the treatment of hypertension. Why? Generally, because if we use loop diuretic, it's a powerful drug, or it because it enhances the excretion of excessive volume, so hypovolemic state can be developed, and patient may be into hypertensive state, right? So that is why for hypertension, mild to moderate hypertension, we do not use loop diuretic, rather we use thiazide diuretic, because thiazide having mild to moderate effect, it's not going to produce hypovolemic state. But in emergency situation where we have to control hypertension to avoid the complication, so in that situation we can use loop diuretic. Hypercalcemic state, especially if a patient having cancer, or uh, we are using chemotherapeutic agent, and due to breakdown of carcinogenic cells, so increase amount of calcium can be produced in that situation. So to because already we have discussed, it not only loop diuretic enhances the excretion of sodium, potassium, right, but also it enhances the excretion of calcium and magnesium. So when the calcium is going to be excreted out from the body, right? So this is how we can decrease the level of calcium from the plasma, right? So that is why the word is hypercalcemic state. So in hypercalcemic state, what is the role of loop diuretic? Because loop diuretics enhances the excretion of calcium. So this is how we can reduce the level of calcium in the plasma. Acute and chronic hyperkalemia. If increased level of potassium, so we can use loop diuretic, because loop diuretic enhances the excretion of uh, uh, not only sodium but also enhances the excretion of potassium. Side effects, if we know the general effects, so it would be easier for us to memorize the side effects, because one of the problem could be it may develop into hypokalemic state, because it enhances the excretion of potassium, and it also enhances the excretion of sodium. So it may produce hyponatremia, right? So hyperuricemia, this is very important, right? Because the diuretics, how diuretics reaches the site of action, because diuretic has to produce its activity on lumen, right? Like proximal convoluted tubule, loop of Henle, distal convoluted tubule. So how these diuretic reaches the site of action into the lumen? For this, it uses organic acid secretory system, which is located in the proximal convoluted tubule, right? So it competes for reaching the site of action. It competes with uric acid. So the level of uric acid can be increased due to this thiazide or loop diuretic activity. Okay? Metabolic alkalosis, because it enhances the excretion of hydrogen ion proton, right? So increased chances of alkalosis, hyponatremia, and this is one of the peculiar side effect of loop diuretic, that is autotoxicity. Autotoxicity, right? So from the drug-drug interaction point of view, what you must remember, the drugs, if a patient is taking multiple drugs, for example, a patient is taking furosemide, and we know furosemide uh, is one of the drugs that can produce autotoxicity. So we have to be very, very careful to administer another drug that is also responsible to produce autotoxicity, right? Like one of the important group, clinically important group is the group belongs to antibiotic group, that is aminoglycoside, in which we have amikacin, gentamicin. So these are the aminoglycosides, and these antibiotics may also produce autotoxicity. So we'll have to be very, very careful to take these two drugs simultaneously. Okay, because loop diuretics enhances the excretion of calcium as well as magnesium, so there is a chances of magnesium depletion. But in adults, it's not a problem. But in older people, we have to monitor the magnesium as well. Now, the second group, uh, that is another very important group on top loop diuretic. Now, this thiazide diuretics and thiazide diuretics, already we have discussed on this segment. It exerts its activity. So, its site of action on this segment in the distal convoluted tubule, right? So it's not a powerful diuretic as compared to loop diuretics, because in distal convoluted tubule, just 5 to 10% reabsorption of sodium take place, right? So less amount of water is going to be sprayed out, right? So we have examples. We have chlorothiazide, which is the prototype drug of this group. Like there could be a question, okay, which is the prototype drug of loop diuretic, that already we have discussed, that is the furosemide. In thiazide diuretic, the prototype drug is the chlorothiazide, but clinically we are using hydrochlorothiazide. Then we have thiazide-like uh, compound or drug that produce chlorothalidone and metolazone. So these are the two examples. These are the examples. These are the drugs which are not true thiazide diuretic but produces activity like thiazide. So we can label as the thiazide-like diuretics. And examples we have chlorothalidone and metolazone. Okay, mechanism of action. It inhibits sodium and chloride transporter in distal convoluted tubules, right? So what you must remember, the site of action. And in case of loop diuretic, what was the site of action? The site of action was thick ascending lymph loop of Henle. And in case of thiazide diuretic, the site of action is the distal convoluted tubule. Okay, increased sodium and chloride excretion, just like in case of loop diuretic. Weak inhibitor of carbonic anhydrase, increase bicarbonate excretion, increase potassium magnesium excretion. Now, this is the point, and this is the point that is asked in the exam. Almost as far as the electrolytes are concerned, Both loop diuretics and thiazide diuretics are similar, except one important or major difference. This you must remember. If you don't remember anything, but you must remember this point. What is that point? Loop diuretics, these are the groups, they are going to promote or enhances the excretion of calcium, whereas thiazide diuretic decreases calcium excretion, or we can say it promotes reabsorption of calcium. Is there any clinical importance of knowing this? Yes. And this is one of the important points, especially uh, with this point, question is asked in your assembly exam. For example, old age lady come to the consultant clinic and complaining of high blood pressure, and when you come to know, okay, this female also has the history of osteoporosis, and at the same time you have to control her blood pressure. So which one of the following diuretic you will select? Definitely you will select a diuretic in osteoporotic female, right? Which one? The drug that can inhibit the excretion of calcium. Because in osteoporosis, there is a uh, deficiency of calcium, right? Disturbance in the bone mineralization. So this group would be the group of first choice because it inhibits the excretion of calcium, or it also enhances the reabsorption of calcium. So in osteoporotic female, this diuretic group would be the group of first choice, right? So this is the point that is very important from the exam point of view. Okay, therapeutic uses in the beginning already, in the slides of loop diuretics already we have discussed. In edematous state, in edematous state, the diuretic of choice is the loop diuretic because having the powerful activity. And as far as the hypertension is concerned, which diuretic we generally use to control the hypertension, especially mild to moderate hypertension, then your choice would be the thiazide diuretic. So this is another very important difference between loop diuretics and thiazide diuretic, right? So in edematous state like pulmonary edema, right, and generalized edema due to cirrhosis of liver, due to nephrotic syndrome, so in which we are required the quick result, emergency result. So we use the powerful loop diuretic. But for mild to moderate hypertension, we would prefer thiazide diuretic, right? But if in emergency situation, it will have to control the hypertension on emergency basis, then we can use loop diuretic. Now the question is why? Why loop diuretics cannot be used uh, as a general antihypertensive drug? And this point also I have discussed with you because it's a powerful diuretic and excessive amount of water is going to be sprayed out. So it may produce hypovolemia. So it may produce hypotension, right? So this is the reason. So for controlling hypertension, the preferred group of diuretic is the thiazide diuretic, right? Congestive heart failure, hypercalciuria. Now focus on this point. Suppose excessive calcium is present in the uh, plasma and calcium is going to be sprayed out excessively, that is called the hypercalciuria. So increased chances when increased amount of calcium is going to be sprayed out from the kidney, increased chances of stone formation. So how we can prevent this excessive excretion of calcium? So the answer would be by using thiazide diuretics because it enhances the reabsorption and prevent the excretion. Osteoporosis, this one already discussed. Nephrogenic diabetes insipidus, right? So because in this condition, excessive amount of urine is going to be squeezed out. But when we use that diuretic, it will produce hyperosmolar urine. So an amount is comparatively with the without thiazide diuretic is lower after the use of thiazide diuretic. Treatment of lithium toxicity, right? Side effects, as already we have discussed, the side effects hypokalemia, just like fluid diuretics, hyponatremia, hyperglycemia. This is one of the or unique side of thiazide diuretics. So this point has some clinical importance, right? Because thiazide diuretic diminish or impair the insulin secretion. When there is insulin deficiency, increased chances of for the development of hyperglycemic state, right? So that means if a patient having a history of diabetes, so before starting thiazide diuretic, we must check the status of our patient, or periodically we'll have to monitor the glucose level, right? So elevated plasma lipids, hyperuricemia, and this point already we have discussed. Because what point already we have discussed? Generally, diuretics reaches the site of action, which is the lumen, by using organic acid or base secretory system. So when diuretic uses this organic acid secretory system, it will compete with uric acid, so it will prevent the excretion of uric acid to level of uric acid may raise, right? So it may causes hyperuricemic state. So another important clinical point, suppose if a patient having history of gout, so we'll have to be very, very careful of using these diuretics. Hypercalcemia, so uh, again the logical answer, because this drug promote reabsorption of calcium and inhibit the excretion of calcium, so chances of hypercalcemic state in the blood. So this is all about the because we have divided diuretic lecture into two classes. In class one, these two important groups already we have discussed: loop diuretic and thiazide diuretic. And in the next class, inshallah, we will discuss the third important group, that is the potassium sparing diuretic, osmotic diuretic, and carbonic anhydrase inhibitors. Right? So, thank you very much. Allah Hafiz.